Thank you for having me here. Hello, everyone. It was quite a challenge to reach here at this hour, and I didn't thought London traffic would be so bad, but that's it. And today I will talk to you about probiotics in the NICU, and I'm sure that everyone who is working in the NICU is using probiotics, but you don't use it. It will be a debate after that. That's good. It's a good start. Okay, so I guess you are one of the people who think probiotics are a hoax. So it started better. But most of the people consider probiotics a hope, and there is a hype in the last year about using probiotics in the preterm babies and in the NICU. And more of this, in 2017, there was a meta-analysis that showed a lot of benefits and was considered the golden age of the use of probiotics in preterm babies. In 2018, an article was very strong about using probiotics in neonatology, and they considered that there is no convincing evidence to support the ongoing controversies about using probiotics. Also, they encourage the standard use of probiotics in the NICU. And the funny thing is that they mention the devil is in the details. And speaking of the devil, disaster stroke 5 years later. And a preterm baby died after receiving probiotics. And maybe you heard about this case because the case had a lot of media coverage. And the FDA immediately reacted and published the image of the probiotic and issued a warning. And maybe you wonder what kind of probiotic it was used in this case. And the one here from Evivo was the guilty one. And the bacteria inside this probiotic was Bifidobacterium longum, subspecies infantis. And after that, FDA published a warning. And in this warning letter, they mentioned the case. It was a preterm baby with a birth weight below 1,000 grams. And after receiving the probiotic, developed sepsis. And after sepsis, the baby unfortunately died. And maybe you will have some doubts and you will tell me, maybe it was a different cause of death. No, they did genomic sequencing. And with the genomic sequencing, they identified the exact bacteria that came from the probiotic supplementation the baby received. And more than this, FDA felt the need to wash their hands and mentioned the fact that all the probiotics are only supplementary food. It's only a device, only a substance that doesn't require the FDA approval. More than this, in the media article they published a quote from the Evivo saying that they had no problems using this probiotic for 5 years and feeding around 60,000 babies with this type of probiotic. But let's see. Short after this warning issued by FDA, suddenly an article appeared, a meta-analysis, and in this meta-analysis, the result was very reassuring, saying that this bacteria is very short to use in neonates, and also it is very useful in preventing necrotizing enterocolitis. So what should we think about it? What is the reality here? What is the truth behind the scene? Could this death have been prevented? And or foreseen? Usually in medicine, before a disaster, there will be signs. And I found another case in 2014, but in this case, the neonate died after receiving probiotic, but not the bacteria itself killed the baby, but a fungus that contaminated this probiotic. And the cause of death was gastrointestinal mucormycosis. I searched the net and I found articles and articles mentioning meningitis and sepsis caused by probiotics starting from 40 years ago. Also, an article published in Children searched the database from 95 to 2021, and it found around 49 cases of sepsis in children up to 2 years old. In 2022, also a systematic review showed 32 preterm infants that had sepsis caused by probiotics. And in 2024, another 8 probiotic sepsis cases were added. In 2025, another case of Lactobacillus rhamnosus sepsis was published. So you see, it's an ongoing issue about the possible connection between sepsis and preterm babies. But what are the scientific proofs behind the use of probiotics in preterm infants? Why do we use probiotics, or most of us use probiotics in preterm babies? We have a lot of proofs of medical scientific proofs that encourage the use of probiotics in preterm babies. And I choose some articles with high number of patients included in these studies, and they showed an improvement of the mortality and morbidity, especially when it comes to sepsis, and especially in this case when it comes to lower respiratory tract infections. Also, there are meta-analyses proving that a combination between one or more lactobacillus species and one or more bifidobacterium species will reduce all-cause mortality in preterm babies. Also, the prophylactic role of probiotics was shown in this meta-analysis with a huge amount of babies, around 70,000 babies included, and probiotics were in favor of preventing NEC. So it is proved in this meta-analysis that NEC stage 2 or above can be prevented with the help of probiotics, and also the late onset sepsis can be prevented with the help of probiotics. Also, an association between probiotics and prebiotics and lactoferrin can be useful in preventing mortality and infections. The routine use of probiotic supplementation to very preterm infants had benefits in this trial published in 2023, and the Bifidobacterium bifidum and Lactobacillus acidophilus were the 2 probiotics used in this case. So what should we do to give or not to give probiotics in preterm babies? Let's see. EBSGAN recommendation from 2020. The paper recommends the use of some specific probiotics, Lactobacillus rhamnosus, or the combination of Bifidobacterium infantis, Bifidobacterium lactis, and Streptococcus thermophilus, but they do not clearly indicate an optimal start or length of treatment. Also, the panel recommends individual units to determine the treatment duration based on the population who will receive this treatment. And the panel conditionally recommends that whenever considering the use of probiotics, a strain with a proven effectiveness and established safety profile should be selected. Also, the American Gastroenterology Association recommended the use of certain probiotics, and one of them, unfortunately, was the one causing the death 3 years later. So, of course, you will have a question about this. American Academy of Pediatrics does not support the routine universal administration of probiotics to term infants, particularly those with a birth weight below 1,000 grams. In 2023, EBSGAN issued a list of probiotics that can be used in different gastrointestinal pathologies. And regarding NEC, they showed us which one should be the chosen one to use and which one are not recommended. But most of all, you should see here Lactobacillus reuteri has no recommendation for it to be used or not to be used. But in 2024, the result of the connection study was published. And this was a large study, an international study, and my hospital also participated in this study. And the conclusion of the study was that the Lactobacillus reuteri was efficient in preventing necrotizing enterocolitis and also proved to be safe. That's why FDA has granted a breakthrough therapy designation for Lactobacillus reuteri. So, Lactobacillus reuteri will become the first probiotic that will serve as a medicine and will undergo the FDA regulation. After all you have seen, FDA and EBSGAN and FCNI published a statement. In this statement, they said highly favorable benefits risk ratio is for the use of probiotics in preterm babies. Also, there is an extremely low risk of probiotic sepsis and is likely to be accepted by nearly all parents. Also, embracing probiotics with a vigilance guided by evidence and practicality should be the best approach. So, instead of conclusion, what do you know? At the beginning, in 2017, all the studies were encouraging the use of probiotics, and we had the golden age of probiotics. But after that, in 2023, we had an unexpected death of a preterm baby after receiving probiotics. And now we have a more cautious situation, and we consider probiotics they can be used, and they have many benefits, but we should beware of risk. It is obvious that we all have much to learn about probiotics, and there will be a lot of published articles from now on. But until then, I just presented you the results of the studies we have by now. Thank you, and